Hello, everyone, and welcome from the College of Arts and Sciences. Thank you so much for joining us for Early Effects of the COVID-19 Pandemic and Policy Responses on Labor Markets. Note that all attendees are muted and your video is off. Throughout the webinar, we encourage you to submit questions by clicking Q&A at the bottom of your screen. Now, to introduce our speakers, I'll turn it over to Professor James Peck, Chair of the Department of Economics.
It is my pleasure to introduce today's speakers. Rebecca McKibbin received her PhD from Yale University. She is on the faculty of the University of Sydney and is spending the year at OSU as a postdoc in the Department of Economics. Her research fields are health economics and public finance. Bruce Weinberg received his PhD from the University of Chicago and has been at OSU since 1996. He has an illustrious record in publishing his research in leading journals and receiving research grants from the National Science Foundation and National Institutes of Health. He currently co-chairs the university's Research Recovery Committee, planning our efforts to ramp up research as we navigate the COVID-19 crisis. Bruce's research fields are labor economics and the economics of innovation. Rebecca and Bruce will be talking about their research on COVID-19, including such fundamental topics as: one, the extent to which differences in state restriction policies contributed to differences in unemployment claims. Two, the extent to which relaxation of restrictions will moderate the economic slowdown. And three, how economic and statistical analysis can help us better to understand the actual prevalence of COVID-19 in the population. Bruce and Rebecca, take it away.
Hello. Hi, everyone. Welcome. Thanks so much for taking the time to join us this afternoon. It's a real pleasure to be able to share our research with you. So what we're going to do today is, for the first half, Bruce and I are going to talk about how economists think about health, as well as show you some of the projects that we've been working on in relation to COVID-19 and the labor market. Then we'll throw it over to you guys and answer some of your questions. So feel free to submit questions in the Q&A as we go, and we'll get to as many as we can at the end. So to start off with, I wanted to talk a little bit about how economists typically think about health. And I wanted to clarify that we don't usually think about health as being kind of pitted against the economy. Health is a really important part of the economy. In fact, it's critical to the economy. And the reason is that when you think about what the economy is, it's really just the place where we are able to make and produce things and sell them to other people to consume. So it's really just all of our activities and people coming together to trade things. And so health is important to people, and so health is important to the economy. So the way that we usually explain health of the economy when we're teaching it to undergrads is kind of in the following way. I think this is a nice, simple framework in order to illustrate how health and the economy come together. So we think about, or health economists typically think about time as being a person's most valuable resource. Everybody is born with some time, and you can do things with this time in order to improve your well-being, make you happy, or as economists usually call it, increase utility. So there are obviously infinite number of things that you can do with your time, but we can think about categories of things that we can do with our time, which are kind of useful categories. And so the first one, which is really important, is that you can use your time, you can trade your time for money. So you can go and get a job or make something and sell it, and you can earn money. And you can use this money to buy things, market goods that improve your well-being. And this is really important in today's economy in 2020. Most things we can't really produce ourselves anymore. We're not all growing our own food on our own land, making our own clothes. So you really need money in 2020, and you need to be able to get a job and convert your time into money. The second type of thing you can do are things that you like doing or that you need to do, but that you're not paid for. So you can cook your own food, you can spend time with your family, you can go and walk, hang out with your friends. Just things that you enjoy, but for which you're not paid. And then the third and fourth category both relate to health. So we can think about two aspects of health and how it affects your time. One is being in poor health can take up time simply because being sick uses up time. If you're lying in bed because you're sick with a flu, that's just sort of time that you waste. So we think about sickness as taking away from our total amount of time and being time that we can't use for things that we would actually like doing. So the second dimension of our health, the second health category is you can use your time to invest in your own health. So health affects your happiness or your well-being in two ways. One is it just makes you happy. It's nice to be healthy and not sick. And health also affects across the course of your life how much time you have to do other things. And so it could be worthwhile spending some time now to improve your health in the future. So you could do healthy activities, you could buy healthier food, things like that. And so the purpose of showing you this simple framework is to really emphasize the point that health both affects the economy and the economy also affects health. So these things are very intertwined with each other. So how does health affect the economy? Well, as I mentioned just before, when you're in poor health, you have less time to do other things. So it means you have less time to produce things. You have less time to work. You are probably going to consume fewer goods that are not healthcare. And then the economy also affects health. Why? Well, because people do need money. People need money to buy things that affect their health and things that make them happy. And so when the economy is going poorly and it's difficult to get a job, you're not going to be able to go and earn money to buy things like food. You're going to be stressed out, and stress can have lasting negative impacts on your health. So how does the pandemic play into this? Well, the pandemic, it can obviously directly affect health if you catch COVID-19 and then you get sick. But it also raises the risk of everything that you do. So when you're deciding, should I go out to the grocery store? Should I go to the gym? Should I go for a walk? Before, the health risks of this were perhaps quite minimal. Maybe you would be hit by a car or something like that, but pretty unlikely. So now on top of that, you also have to consider the potential risk that you're going to get COVID-19 and possibly also give it to your family. And so since the cost of everything is going up, people will naturally do less of everything. They're going to do less of things that cost more. And this, as people are doing less of stuff, unemployment is going to rise. And the reason is that if people don't want as much of what you are producing, then we don't need to pay as many people to work to produce that. And so as people are losing their jobs and there's less employment, this is going to have negative impacts on health. And so as I mentioned before, when people are not able to get a job and earn money, this can have a negative effect on their ability to keep themselves healthy. So it's also important to note, though, that health risk changes behavior. So I mentioned before that people will do less of everything, but overall, but some things they're going to actually do more of. There's going to be some substitution. And you can think about COVID-19 as not equally increasing the risk of everything by the same amount. And as we learn more about how the disease is transmitted, we'll understand that some things have become much more risky than other things. And so we'd expect to see over time, people will start to substitute towards these not as risky activities and away from things that are riskier. So we're going to see some changes in what people demand. And so in all of this, I've never really mentioned government policy and social distancing. And the reason for that is that I wanted to emphasize that irrespective of what happens in terms of the government requiring people to socially distance or other kinds of policies that have come up in response to COVID-19, the pandemic is going to have an effect. So it's not 100% going to be as a result of policy actions. The pandemic itself is really changing the economy. But so there is a role here for policy. And the reason is because of what economists call an externality. And an externality occurs when your individual actions affect other people's well-being. So when you're deciding whether or not it's worth you going out of your house to go to the gym or the grocery store or take a walk, you're most likely just considering how much you're going to enjoy doing this, or how much you need to do this relative to what it's going to cost you and perhaps your immediate family. You're not considering how this is going to affect everybody else in your community. And if everybody does this, even if it's just a tiny impact that your actions are having on the overall risk of increasing the prevalence of COVID-19, that's going to add up to a big increase in risk. And so that's where there becomes a role for a policy to come into place, which helps bring back down the level of activity that people are doing to an amount that's best for the economy. And so that's where we get social distancing policies coming in. So moving to our research goal. So basically our research goal is we want to look at what kinds of policies are the right policies. And what are the right policies? Well, they're things that keep people healthy, both in terms of not catching COVID-19 and also in terms of the negative effects of having a bad economy. And we want to look for things that help people stay in jobs. And so to do this, we want to incorporate into our policy analysis a feedback loop between health and the economy. So now I'm going to move to describe a specific project I've been working on, and then Bruce will show some of our other projects as well. So one of the projects that I've been working on recently is to address a fundamental challenge with this policy analysis, which is that we really don't have good data on how many people have had COVID-19. And so that means when we're looking at how particular policies have affected our ability to contain the pandemic, we don't really know what's been effective and what's not been effective, because we don't know how many people actually have COVID-19 at any point in time. And so that makes it difficult. And so what we want to do is we want to use tools from economics to try to shed light on this. And so I'll show you what kind of data we have and what we hope to do with it now. So this graph shows an example of the kind of data that is available on COVID-19. And what we have here in the gray line is the number of tests that are being conducted each day. And you can see it's between around 1,500 and 6,000 per day. And then the orange line shows the proportion of those tests that come back positive. So out of all the people who go and get a test, we can see what proportion of those tests come back positive. And so, for example, if we take the 11th of March, we can see about 6% of people who got a test in this location had that test come back positive. Now, this is not going to be an accurate estimate of how many people in the general population have COVID-19 on the 6th of March. And the reason is because it's obviously selected. These people who go and seek out a test have some reason to think that they have COVID-19. Maybe they feel sick, maybe they know somebody who's had it. But this type of selection is something that we're really familiar with dealing with in economics. All the time in economics, we deal with problems of trying to analyze effects in situations where people have made choices to do things. So for example, in labor economics, we have people who are choosing to take particular jobs. We have people who are choosing whether or not to be in and out of the labor force. And so we can use the statistical techniques that we typically use to analyze these problems and apply them here to this selection problem. And so basically what we want to do is we want to do what's called comparing the average rate to the marginal rate. So the average rate was what I just showed you in that graph. It's the proportion of people who get a positive test given that they selected to go and have a test. And what we're going to compare that to is the marginal person who goes and have a test. And the marginal person who goes and has a test is a person who gets the test because there was an additional test available. So if you can imagine that we just give a state 100 extra tests, more than they had yesterday, what's the probability that the people who receive those 100 extra tests have COVID-19? And that gives us an estimate of the upper bound or the maximum number of people who have COVID-19 in the population on that day. And so we haven't done this analysis yet, but this is kind of to give you a flavor of what the results would look like. So we would have our average positive rate in the orange line, we have our number of tests in the gray line, and then we'd have a third line, a blue line, which is mapping out the marginal rate. And so this would give us an idea of what the maximum number of people or proportion of people who have COVID-19 on a particular day is. And so this is something that we would estimate using our model. And so, for example, if we take here, say the 13th of March, you can see that the average positive rate is about maybe just below 5%. And in our pretend estimates, the marginal is maybe 2.5%. And so I look forward to being able to show those results at some point in the future. But for now, I'll hand over to Bruce, who's going to tell you more about work we've been doing on the current policies and their impact on the labour market. So over to you, Bruce.
Great, thanks, Rebecca. So I'm going to talk to you about a couple of things that we've already been doing that are further along than a lot of the work that Rebecca's talked to you about, but very much, I think, aligns to it. So the first question that I want to queue up is to think about how and whether state policies have affected job losses. And the backdrop for this is that, for better or worse, a lot of the decisions relating to COVID-19 policy are being made by states. The federal government has allowed states, taken the position that states should be on the front lines in terms of making policies. And so if I'm a state governor, I need to be thinking about how the policies that I'm pursuing are affecting my state and my state's economy. And so in particular, I think we're interested in how this would be affecting labor markets, or as a labor economist, that's my focus. So I think the point that I'd like you to take from these slides, the first set of results, is that the labor market impacts of the responses to COVID-19 and COVID-19 itself are primarily national or international. They're not local. So how can we see this? Well, this is work with a number of folks, and many of them at Indiana University. And this plots the unemployment claims, the new weekly unemployment insurance claims that we hear about every Thursday morning, over time at the very, very beginning of the pandemic in the United States. And the left side focuses on COVID-19 cases. And what you can see, and the right side focuses on school closures. And what you can see is that new unemployment insurance claims were moving along at a relatively low rate until the very beginning of March, and they were quite steady. And that's consistent with the economy being in good shape at that point. Then, right at the beginning of March, as COVID-19 cases start becoming more prevalent in the United States, unemployment insurance claims rocket up. This is our version of the hockey stick. And I submit that, compared to the environmentalist hockey stick, it's a pretty striking uptick. And so you can see we've broken things down for three groups. We have states where COVID-19 cases are relatively low, states where they're in the middle, and states where they're the highest. And I think what's striking about this figure is that the increase in new unemployment insurance claims is tremendous in all three sets of states. So it's not that the states that had more COVID-19 cases experienced substantially more rapid slowdowns in their economy, or labor markets at least. All the states did. And similarly, if you flip over here and you look at the school closures, and we focused on school closures because these were really the first things that states enacted, you can see there actually is somewhat greater separation between the states that enacted school closures early and the states that enacted school closures in the middle and late, but it's relatively small. It's small relative to the increase. And in fact, even for the states that had very minimal school closures, there's a six-fold increase in new unemployment insurance claims in that week. And that is just a completely unprecedented increase in unemployment insurance claims. So the first take home here is that labor market impacts are not local. They are national, they're international. And I think the point to think about is that people are producing things, and some of the things that they're producing, like restaurants or retail, are going to be affecting the local demand, the local economy, and for local consumers. But a lot of what we're producing is supposed to be affecting the national market and supply to the national market or the international market. And there's simply concern and not demand for a large portion of the products that people are doing. The other thing is, while the effects are primarily national or international, not local, not all groups in the labor market are affected equally. And so this figure tries to show this. What we've got here is the change in employment for 3 recent recessions, the 3 most recent recessions. And I think there are a number of big picture points to take from this figure. So the first thing is that recessions are bad for the labor market and they're bad for everyone. And I think that probably something that we understood to a greater or lesser extent. The second thing is, you can see we have the 2001 recession here in orange, and then we have the Great Recession in this bluish color. And you can see that the Great Recession is substantially worse. The employment declines in the 2001 recession, which was a relatively shallow recession, were much, much smaller than the employment declines in the Great Recession. And that's why we called it the Great Recession. The other thing to notice is we have the COVID-19 recession employment drops here in gray, and they just dwarf even the Great Recession. And these data come from just the middle of April. So in just an incredibly short period of time, COVID-19 has reduced employment by far more than occurred from the peak of the economy before the Great Recession to the point at the very, very bottom of the Great Recession. So, there's just a tremendous amount of jobs that are being lost in the COVID-19 epidemic in the United States, even relative to the Great Recession. Then there are a number of other facts that I think are really worth pointing to here, and that's about the disparities in impacts across different groups. So if you look at the education bars down here at the bottom, you see something interesting. People who have college degrees or higher experience smaller job losses than people who have some college or who are high school graduates. And the evidence that we have indicates that the reason for this is because people who are college graduates have better opportunities to work remotely than high school graduates and people who have some college. But there's something else that's interesting here, and that is the people who haven't even completed high school also have smaller employment declines than the people who graduated from high school and the people who have some college. And here, comes with a silver lining but a dark cloud too. So on the one hand, it's good. People who don't have high school degrees are economically very stretched for the most part. And so the fact that they've been able to maintain their jobs is a great thing. On the other hand, our data suggests the reason that they're maintaining their jobs is because they're in essential jobs. And so the concern is that they may be being exposed to coronavirus as part of their jobs. They're getting to keep their jobs, but they may be being exposed to coronavirus as part of that. And that's very different from people who have college degrees, who for the most part, and you can think of occupations, medical occupations, for instance, especially where people are being exposed to coronavirus even at high education levels, but for many highly educated workers, keeping their jobs, but with less exposure to coronavirus. The second thing that I think is very interesting to look at here is the age gradient. And the impact on job loss is much, much greater for people who are just entering the labor market than for people who are well established in the labor market. over 20% of 21 to 24-year-olds had lost their jobs even by the middle of April, compared to less than half that number, under 10% of people who are 45 or older. So, I think there are a number of things to take away from this. The first thing is that evidence suggests that if you lose your job, especially when you're young, that can scar you and stick with you for a very, very long time in the labor market. And so there's a real concern that people who are relatively young entering the labor market may be experiencing adverse outcomes that will last with them for a very long time. The second thing is, I think, very interesting from a health policy perspective. And this gets back to the issues that Rebecca was talking about earlier in terms of health and the economy and the extent to which they're aligned versus trade-offs between the two. And here you would think from a health perspective that the people who are relatively young are not immune to COVID-19 and they can have bad health outcomes, but the probability of bad health outcomes is lower for people who are young than as you get to older and older groups. And so while employers are prioritizing maintaining relationships with the people who they've been employing for a long time, and that's obviously good in those groups and maintains relationships which are important. On the other hand, it does mean that the people who may have the worst health outcomes from getting COVID-19 are continuing to be exposed to it, whereas people who might have had less adverse health outcomes have less exposure. We see a number of other findings that I think are interesting. We see very large disparities between Hispanics and non-Hispanics. This has a lot to do with being in an essential job. Similarly, between Blacks and whites, although in these data, those disparities aren't as large as the Hispanic, non-Hispanic disparities. We've also looked to see how women have fared relative to men, and also if there's a gradient with number of children, and especially given the importance of school shutdowns, and meaning that people had to stay at home perhaps in order to take care of their children and homeschool them. And we do see somewhat larger declines in employment for women than for men, although in these data they're not tremendous. We also do see somewhat smaller declines for people who have no children than for people who have children, or for people who have young children compared to people who don't have young children. Although as a whole, those disparities aren't enormous. And so I think one of the things that we're very much interested in doing as we move forward is to try to think about how those are evolving as the epidemic continues. Just to give you some sense of the data that are behind things, what we have here are the occupations that the census classifies workers into in the economy, and we're plotting the change in unemployment, becoming recently unemployed between March and April, on whether you can work remotely in your job and the extent to which face-to-face contact is important on your job on the right. And you can see, and not surprisingly, if I can work remotely, I'm much less likely to experience unemployment recently than if I can't work remotely. And this is the story behind why the highly educated workers are typically maintaining their jobs. You will also see that if it's important for me to be face-to-face in my job, it's much more likely that I will have lost my job recently. So where are we heading next? Our real goal is to try to provide information that's useful for policymakers to help thinking about health and employment. And as Rebecca was saying, these two are intimately intertwined, intricately intertwined in this case. The economy affects health and health affects the economy. And one may think in some circumstances about a trade-off between health and the economy. But in this case, really the ability to maintain health is critical for the functioning of the economy, and the functioning of the economy is critical for maintaining people's health and mental health. So we want to take all these different elements that we've discussed here and try to put them together into a model where we can look at this feedback loop between health and the economy and health. And then, as I say, to use that information, the results from these models, to help inform policy and to think about what different policies, what ramifications they would have for both health and for the economy. So why don't we stop the formal part of the presentation at this point and open things up for questions. As Rebecca says, there's a chat function open, and you're more than welcome. We'd love to have you send us questions that you have in the chat box, and then we'll do our best to respond to them.
Oh, okay, great, thanks. So we'll start off I'll start off by taking a question. And the question is, from a macroeconomic perspective, how do we measure the impact of closing businesses compared to the health impacts of social distancing? So I think this is a really great question, and it kind of gets to sort of what we wanted to do in our own analysis, is try to quantify health impacts, trade them off against economic impacts. And so it doesn't have a simple answer, but I think broadly what you could do is, the way that we typically measure health against anything is we try to convert health into dollars. So we add up all the health impacts and convert them into something monetary. In the US, typically the value of a life is taken to be $7 to $9 million when you're considering things that impact people's health. And then you could compare this to the loss of GDP, which is a measure of economic activity. So that would be one kind of direct trade-off, the COVID-19 deaths or other deaths and health impacts against GDP. What's really challenging is working out how do we actually measure these health impacts that come from poor economic outcomes. And the reason for that is that, it takes a long time for these things to be realized. So we won't know what those health impacts are for a long time. And this really is an unprecedented shock. So we don't have that much that we can look at historically to give us an idea. So we're talking about kind of looking at what happens when you drop a bomb on the economy, as opposed to when some kind of incremental change in the economy happens, which is what we have data on. And so, yeah, I think the techniques that we have where we convert health into dollars and compare them to other dollar measures is how you would do it. It's just a matter of trying to work out how big these health impacts will be in the long run when the long run hasn't occurred right now. So do you have anything to add, Bruce, or do you want to take a different question?
Yeah, let me take a question. So, one of the questions that we received was the impact of the coronavirus on the graduating classes of 2020, and I think that's a really critical question. As you saw in the results that I was showing you, the youngest workers, these weren't necessarily people who had just graduated, but the youngest workers were very adversely affected by the pandemic in terms of their employment. And so I think, while individuals who have jobs, and I know many of our own students who have jobs are for the most part managing to maintain those jobs and just perform them remotely in the short run, I think the long run implications of this could be quite substantial for a large portion of the class of 2020. And our estimates are really showing that the youngest workers are very adversely affected by this, by the pandemic.
Okay, so the next question was, what are the key variables or factors that governors should consider when they're deciding to reopen, and why? So what I would say to that is, the purpose of the shutdown was to get the outbreak under control. If you have the outbreak under control, then you don't really need a shutdown. So the problem is that if the outbreak is out of control, then you just have COVID cases rising and rising and rising, and that's going to just cause the economy to contract and contract and contract. And so we had a shutdown in order to get on top of that outbreak and to stop hospitals being overwhelmed. And so I'd say the number one thing that governors need to look at when they're reopening is whether or not the current outbreak is under control. And so how do you have the outbreak under control? I mean, that's something really for the medical experts to answer, but, you know, basically what I've seen myself in this area is that you want to be able to contact trace, you want to be able to test, and you want to have some best practices in place so that you can hopefully kind of mitigate the spread once things reopen.
So one of the questions that we got that maybe, you know, aligns with some of the things that you were saying, Rebecca, was about the way forward from this. You know, and I think here, as I think we've both been emphasizing, you know, one wants to think about the response as not being so much a trade-off between health and the economy, so much as an alignment of health and the economy. The thing that's going to be best for the economy is for people to be in good health and have high confidence that they can go about their activities without experiencing adverse health impacts. And similarly, the best thing for the health is to have the economy functioning well so that people are getting their jobs and able to continue going to work and being productive and having incomes. In the sense that we haven't studied this ourselves particularly, although I think it would be very interesting to, is that the countries that seem to have done the best job managing COVID-19 from a health perspective have also, it seems, maybe in the short run had adverse economic impacts because they've had to respond very, very quickly and dramatically. But in the long run, it seems like maybe they're doing better. And there's research that's been done using previous pandemics, most notably the 1918 pandemic, that suggests that, for instance, states that were more aggressive in responding to the pandemic in 1918 actually had better long-term health outcomes than states that had less aggressive responses.
Great. So another question is, how has COVID affected bars and the restaurant industry? So far, we know that the shutdowns have certainly affected bars and restaurant industry quite a lot, because you can't really work from home if you're working in a bar or in a restaurant in the restaurant industry. And although there's some demand for takeaway and carryout, it seems like it's clearly not as much as there is for in-person dining. And you know, when it comes to bars, there's not so much of a market for takeaway alcohol from a bar. What will happen going forward? I guess we're probably going to find out in the next few weeks, but I would anticipate that any kind of in-person activity where it's difficult to socially distance is going to experience some loss of demand, unless it's something that's extremely essential or that people just absolutely love doing. And even though some people may absolutely love going to restaurants and bars, I think that that's not going to be something that everybody loves doing enough for it to not experience some contraction. So, you know, I hope that restaurants and bars will recover well, and I guess we're going to find out. But, you know, like I mentioned at the beginning of the presentation, if the pandemic continues for a long time, there's going to be some structural changes in the economy, and kind of possibly permanent changes in what kinds of things people want to consume.
One of the questions that came in was about the scarring effects on graduates from the Great Recession. And that's not something that we've studied. But that is something that economists have studied. And the sense is that the adverse effects are very, very substantial. That coming into the labor market in a recession basically puts you on a completely different trajectory that lasts for a very, very long time. It's not that once the economy recovers that you sort of go back up to where you would have been. There's a long-term scarring effect from that. as I say, that's not research that I've done, but it's fairly well established that Rebecca's done, but it's research that's fairly well established in the economics literature.
So next question is, do you think policymakers adequately appreciate the cost of shutdowns, and have they prioritized reducing COVID deaths over the deaths from other things that are caused by the poor economy? So I've truncated that a little bit, but basically these flow-on deaths. So I can't speak to what policymakers were thinking exactly when they did this, but I do think that when you think about like the number of people who could have immediately died from COVID-19 being in the millions, and then you think about how hard it is to even compute the economic effects, the effect on health from the poor economy, there's some element of there being a disparity in the magnitude there. So when something's really hard to compute, then you have to wonder whether or not it's kind of small. So I would be surprised if the impact of the economic contraction on long-run health would be larger than a couple of million people dying from COVID-19. And so I think and also, as I said before, the purpose of the shutdown was also just to stop the pandemic spiraling out of control, which would lead to the economy tanking. And, you know, if the disease is there and it's really prevalent, unless it goes away, which we don't know if it would, we don't know whether herd immunity is actually going to occur or whether that's going to be a characteristic of this disease, then we could have to live with a high prevalence of this disease for a long time, which is really going to fundamentally affect the economy.
So I think there are two questions that have come in that I think connect up to what you're saying, Rebecca. So one is, you know, the hopeful end game here is that there will be a vaccine that will, you know, in the short run, hopefully much better treatments and tracking and tracing, you know, testing and tracing, contact tracing, but in the long run, a vaccine. And then the question is, how long would we expect the economic recovery to take after a vaccine is available? There's a second question, that's I think broadly related, which is, you know, how long can businesses or the economy remain shut before we start losing jobs permanently? And I think those questions are they're not the same question, but I think the answers to them are quite linked. And so clearly, the longer the thing that economists have found is that labor market relationships are very costly to establish and important to maintain. So that if we have a lot of disruption in the economy for a long time, that's going to mean that there's going to be a loss of jobs, and those jobs, when people have to find new jobs, it's going to take them a while to do that search process. And then on the other side, companies are going to need to hire people, and it's going to take them a while to sift through applicants and get the people that they need back to them. And similarly, on the supply chain side, you know, if I'm producing something, I need to find people to purchase it from me, and then I need to find people to produce the inputs that I need into my production process. So in these cases, I don't think we have a specific number. I don't feel like I can give you an answer, at least based on our research, although that's something that we're really trying to work on now, trying to look at the reopening side and see how, as states have reopened, how that's affected their economies and whether their unemployment rates have started to go back down. But clearly, the longer the epidemic lasts, in terms of when we get more effective treatments or a vaccine, the longer the economy is shut down, the more disruption there is to business, the harder it is to restart the economy. So, I mean, at one level, one could take all that and say, you know, well, it's really important to get everyone back to work. The flip side of that is what I think Rebecca and I have been trying to emphasize, which is that health risk being prevalent in the economy and in society itself has a dampening effect on the economy. And so the key, I think, really needs to be to try to get in. I mean, this is speaking in terms of public health, which is not what I do. I'm a labor economist, but in that case, I think what from reading what people have said, the key is to implement testing procedures and contact tracing procedures so that we can get the prevalence down to a level that's manageable for the economy and reopen a large portion of the economy so that we don't experience the same level of scarring effects that we potentially will.
So another question is, do we think universal healthcare will be an outcome of this pandemic? So the decision to have universal healthcare is really a political decision. So again, it kind of depends on the politics going forward. I think perhaps the way to turn this question more towards economics is whether or not this pandemic is demonstrating that there's some sort of case for universal healthcare that wasn't there before. And I guess I don't think so. When I teach health economics, we always talk about the different kinds of healthcare systems that exist in the world. And I come from a country that has universal healthcare. And so I actually do like universal healthcare a lot. But the economics behind whether you have universal healthcare or some kind of private system, it really comes down to there are winners and losers in every system. And so it comes down to how you feel about redistributing among people. So the advantage of a universal healthcare system is that everybody gets healthcare, but everybody gets less healthcare. Well, everybody gets a sort of a smaller amount of healthcare. And so what this means is that for people who are wealthier, they don't get as much healthcare or as good quality healthcare as what they would get in a US style system. But people who have less resources, they get better healthcare than what they would in a US style system. And so it's a question about whether or not you believe things should be equal and whether healthcare should be provided in a way that's regardless of income, or whether or not you think that if you earn more money, you have the right to have more healthcare. And so with regards to this pandemic and the fact that there has been this problem in the US where when people don't have access to healthcare, then some segments of the population are sicker, and people might be reluctant to seek out testing for COVID-19 because they're fearful of costs. I think that certainly shows. It highlights the inequality that exists in this country. I mean, the inequality was there before. So I think it really depends on how people feel about inequality. And I certainly hope that inequality will get more attention, because I personally think it's something that needs to be addressed, and that's really important. What will happen going forward? I think that just, it's a political question. But in terms of whether it's an economic case for having universal healthcare, as opposed to having a private system like the US, it's actually not as clear cut as it's sometimes made out to be. They're just kind of systems that have different pros and cons. But I mean, I will say that most of the world thinks having a universal healthcare system is superior to a private system. So you can take away from that what you wish.
There's our view from down under, right?
Countries in terms of coping with the pandemic. I think somebody asked which countries are doing the best. Australia's down to having only a handful of cases per day.
So there are a couple of questions from some of our awesome recent undergraduates that are kind of aligned with each other. So there's a question about how consumers will change their behavior going forward. And there's a separate question about, how the pandemic and employment losses will affect people's savings in the years going forward. And I think that the sense that people had from the Great Recession was that savings rates, I mean, part of the cause of the Great Recession where people were overextended, but that people's consumption patterns are going to decline. Consumption expenditures are going to decline, and that savings likely will increase in a post-pandemic world. Obviously, during a recession, that's a time when people typically are dis-saving, where people are taking money that they've managed to save up and spending it in order to maintain themselves, especially if their incomes are down. So I think in general, and the evidence has been that so far has been that people really are being much more careful in terms of how they spend money. I think part of that is a lot of the things that we've spent money on traditionally are things that are done as part of outside the home activities. And if you're not leaving the home as much, well, there's just, you don't need to go to Disney World, and spend your money there, or whatever that activity may be. So I think so far it seems like there's been a substantial reduction consumption, substantial concerns about the future. Although, one form that, as I say, that's taking is people dissaving.
So the next question is an excellent question, and it says that I mentioned that a life is worth $7 to $9 million, and the US just hit 100,000 deaths, and so that's using this value, a financial cost of 700 to 900 billion. However, the US government has already injected $3 trillion to offset this shutdown. Was that decision financially sound? So the reason that I wanted to highlight this question is that I think this is a common misconception that we've been hearing a lot about. And the misconception is that it isn't about the number of deaths that we've had, it's about the number of deaths that we haven't had. And so it's tricky to do a cost-benefit analysis here, because we have to make an estimate of how many people we think would have had COVID-19 and died if we hadn't done the shutdown. And so if the true number that would have died without a shutdown is 1 million, then we've actually saved 900,000 people, which is worth 900,000 multiplied by 9 million. So if that was the case, then yes, it probably was a financially sound decision. And so, yeah.
So I think a couple questions that that relate to how to think about these trade-offs from an economic perspective. So one question is how to separate the costs, the effects of the disease itself from the policies that people have implemented to control it. And the second thing is, whether we'd really studied this type of thing before. And I think, unfortunately, I'm not aware of a lot of studies that have studied these kinds of trade-offs between economy and health. There are economists and others have studied the long-term effects of for instance, the 1918 flu pandemic, and it turns out that people, for instance, who were in utero at the time of the 1918 flu pandemic have lower birth weights, worse long-term outcomes. So, even someone who's, in utero, isn't even born, experiences substantially worse long-term outcomes. But that, I think, is a different matter than whether we've analyzed these kinds of trade-offs. And I think that the simple answer is that there's not a lot of research that had been done. I think there are people now who are going back to those episodes and trying to say, well, what can we learn from those episodes that may be useful for us going forward with this policy. But I think there's a tremendous amount of research. I mean, obviously our group, Rebecca and me, and the people we work with at Ohio State and at other universities are doing a tremendous amount of work. And so I think that will be available in the future to try to think about sort of health impacts of policies, economic impacts of policies, and how they feed back into each other. But I'm also seeing that we're getting close to time here. So perhaps we have time for one additional question. Rebecca, is there one that you've seen that you want to try to answer?
So I guess it's an amalgamation of a couple of questions. I just tried to scan to see if we covered everything. And the question is something along the lines of like, what's the way forward? What do we see happening in the economy going forward? And so I think that while the pandemic remains with us, or while this disease remains with us, we're going to see people change their behavior away from things where there's a higher risk of catching COVID-19 and towards things that are less risky. And I guess the longer that it continues, perhaps the more permanent those shifts will be. I think in terms of the way forward to stop the pandemic kind of getting worse and worse and worse is what we talked about before, which is that we have and we hopefully will develop even better tools to try to keep the prevalence at least at what it is, if not try to lower it down. We're still in the early days here. So although the curve is flattened, some countries have actually gotten their cases right down, and we'll see, Australia was an example I gave before, we'll see what happens in those countries as they open up and whether or not they're able to sort of stop new outbreaks occurring, or whether this is just something that we're going to have to fundamentally adapt to until such a time as there is a vaccine.
Great. Thank you, Rebecca. And I completely echo that response. And I think one of the other questions that did come in were examples of countries that had managed to control COVID-19 well, and obviously Australia and New Zealand seems to have done an exemplary job. My sense is also a number of countries in Asia have as well, South Korea being an obvious case. And I think, in some sense, maybe that gets back to this question about what we know from previous epidemics. And, I'm not sure this was the case in Australia and New Zealand, but certainly many of the Asian countries experienced the SARS epidemic and other recent epidemics that didn't spread nearly as broadly as COVID-19 has. And, it seems like probably have learned something from those episodes that have informed their policy. But why don't we, we're pretty close to time at this point. So why don't we stop at this point? I want to thank everyone for being here. I see many familiar names and faces, people, students and alumni from a wide range of cohorts from the department. It's great having you be here today. Obviously, thank you very much to Rebecca for joining me here, and for Jim Peck for the lovely introduction, and for the team at Arts and Sciences for putting this whole webinar together. Thank you very much.
Thank you all for joining us today, and thanks to our speakers for sharing their knowledge. We encourage you to check out upcoming events with the College of Arts and Sciences, including a virtual screening and discussion of the film Bird 1933 with the Byrd Polar and Climate Research Center on May 28th. And join Department of English faculty on June 3rd for a conversation about Jane Austen's Pride and Prejudice during the first book club webinar of the summer. We appreciate you all, stay safe, and go Buckeyes.